Other drugs that are approved for patients that have relapsed disease include radioimmunotherapy. The drug Zevalin is also approved for patients that have relapsed follicular lymphoma. And recently, we saw the approval of obinutuzumab, which is approved in combination with bendamustine in patients who have relapsed follicular lymphoma that is Rituxan refractory. When thinking about patients that are treated in the third line, idelalisib, as I mentioned, it was FDA approved now a couple years ago. This drug is given orally, and its approval is based upon a phase 2 trial in patients that had relapsed and refractory follicular and other indolent lymphomas. The drug had an overall response rate of almost 60% with a remission time of around a year. The drug is associated with a very unique side effect profile, and this is mainly colitis, pneumonitis, and transaminitis. These events can occur at different times. Usually transaminitis occurs fairly early in the first 1 to 2 cycles, and colitis can occur early or late. Now, colitis is clearly an issue, not only because it's inconvenient for the patient, but in some cases the colitis can be very severe, and patients have even been admitted to the hospital with low blood pressure and even ended up in the ICU with significant colitis that occurred late with exposure to the drug. Now, I'll contrast that to copanlisib, which again was also FDA approved, and that drug is associated also with its own unique side effect profile. As I mentioned, it hits the alpha and beta isoform of PI3-Kinase, and that gives it side effects such as hyperglycemia and hypertension. The colitis appears to be less, significantly less than what we see with idelalisib. This could be due to the mechanism of the drug or possibly the route of administration. As I mentioned, this drug is given intravenously, so it bypasses the gut. And again, we don't see as much of the acute or the late colitis. Again, whether that's due to mechanism of the drug or delivery, I think it's still under investigation. So when we're thinking about when to use each of these two drugs, I think it again comes to, like a lot of things I've said in this program, due to it really should be, the decision should be made after a detailed discussion with the patient, as well as a close look at the different side effects, as well as the efficacy of the different drugs. In my mind, both copanlisib and idelalisib are effective in this patient population. I would not be giving a drug like idelalisib to a patient that maybe I was worried about colitis or I would not be able to follow closely. And on the counter, I would probably be looking to avoid a drug like copanlisib in a patient who was at risk for episodes of high blood sugar, in fact, potentially for a patient that has uncontrolled diabetes. But again, both these drugs are available. I do think that they're both very effective in low-grade lymphomas. We'll have several new drugs that are also coming down the pipeline, which are very active, and hopefully we'll see combinations of some of these new drugs in the future for our patients with relapsed low-grade lymphoma.